Quite frankly, he either misled the House or was indulging in a barefaced lie.
There may and likely will come a time in which we have both an airborne disease that is deadly.
Once again, it's that old thing of refusing to admit when you got it wrong.
Is anybody really surprised by the callousness of this government?
We have to put in place an infrastructure, not just here at home, but globally, that allows us to see it quickly, isolate it quickly, respond to it quickly.
And yet today, we're being told to forget about this.
It may be in the past, but we're living with the impact of all those decisions.
And even now, they're trying to manipulate our understanding and memories of the past.
We ministers were not told about the asymptomatic transmission.
The thing that we didn't know in particular, Mr. Speaker, was that COVID could be transmitted asymptomatically.
But all it takes is a little bit of research.
There is a large iceberg of people who've got asymptomatic infection, so a very large number of people have been infected in Hubei without being detected.
It looks quite likely that there is some degree of asymptomatic transmission.
The thing about this disease, it's an invisible enemy, and we don't know who's transmitting it. The thing that we didn't know in particular, Mr. Speaker, was that COVID could be transmitted asymptomatically.
Currying of the test to Jacob Rees-Mogg's child when nobody else could get a test. I'm not surprised that, first of all, they don't care about us.
Today we've strengthened the rules so that all care home residents who are discharged from hospital will be tested before being admitted into their care homes.
You mean there's one rule for them and one rule for the rest of us?
Surely not.
Oh my good Lord.
Department of Health and Social Care. The UK is one of the most prepared countries in the world, and we've delivered more than 1 billion items of PPE since the global pandemic. This is an unprecedented pandemic, and we have taken the right steps at the right time to combat it, guided at all times by the best scientific advice to protect the NHS and save lives.
And the public can be assured that the whole of the UK is always well prepared for these types of outbreaks.
Well, I think only a fool would come on your programme or any programme and say that there aren't things that we could and should have done better in the...
Welcome back everybody to Political X. If you'd like updates on UK, US and EU politics, please make sure you click that subscribe button. Today we're going to be talking about why does Britain have one of the highest COVID death tolls in the world. We're going to be linking that to the policy that was put forward for herd immunity by this Conservative government led by Boris Johnson. The government clearly put forward a policy of herd immunity, and further proof was given through Dominic Cummings, who tweeted the thinking behind herd immunity. Essentially, the plan was to set it up so that the herd immunity took effect over the summer, and therefore in the winter when we had the influenza, there wasn't such a burden on the NHS, and combined it with lockdown policy. And the idea was that it was going to be forward thinking. Except there's a problem. If you offer herd immunity and you do it without a vaccine, which is what this government has done, you kill large numbers of people. There's no guarantee it'll work, and we have a number of diseases that you'll all be aware of, such as measles, that are not eradicated by just having herd immunity. You need a vaccine. And you don't know what the long-term effects are. Well, we're starting to build a picture of what that damage is. It's called long COVID. 1 million UK citizens have it. That's damage to lungs, that's extreme fatigue, inability to think. And interestingly, Dominic Cummings tweeted about this, which stated that having long COVID gave you a risk of death increase by 50% and risk of developing various cardiovascular, neurological and other complications also increased by 50%. These are serious consequences created by a government that deliberately got everyone infected and had no idea what the consequences were of allowing COVID into the country. And you'll hear some really interesting other excuses. Have a listen to Teresa Coffey talk about what's caused this high death rate.
Can you explain why we currently have the worst death rate in the world? And can you explain why we have one of the highest death tolls in the world? If we did everything right, how have we ended up here?
Well, as I say, we've been learning throughout this process, working with scientific advisors on trying to take the appropriate policies. There'll be a variety of reasons why people, unfortunately, have died due to this. Some of that will be recognising the age of our population. Some of that will be recognising the obesity of our population.
Listen, I applaud you for giving us some reasons, because
Yeah,
none of your,
that's the first time we've heard a government minister settle on a couple of explanations.
Right, none of your colleagues last week could give us any. So you've given us two now, ageing population and obesity. So are you saying that the reason for us having the worst death rate in the world is because of the public? They're too old and they're too fat?
I think that's a very insulting thing that you've just said.
You just said it.
Is unconscious age of our population. Some of that will be recognising the obesity of our population. But there's a variety of factors which will have led to people, sadly, being ill during this.
Oh, I see. It's my fault, is it? Oh, of course. There I was thinking it was your fault because you've been left in charge, or Manuel's fault for not waking you, and all the time it was my fault. Oh, it's so obvious now. I've seen the light. Well, I must be punished then, mustn't I? You're a naughty boy,
Now, as much as I like Faulty Towers and having a bit of comedy inserted in here, there is an absolute truth being said. The government are in charge, but it's our fault. It's the public's fault. We got too fat and we got too old. Except that's not true either. You'll also hear about population density being a cause. But if you look at countries like Taiwan, high population density, 47% are obese. They have to bring in food. They're an island. Didn't have these problems. Hong Kong, low death rate. Vietnam, low death rate. Australia, low death rate. New Zealand, low death rate. We've had 130,000 dead in a year. That is more than the Nazis managed to do in 5 years of bombing us. Just let that sit with you for a second. You should be angry and frankly never vote Conservative ever again, because this has been one of the worst performances by any government ever. There seems to be 4 options: to have a vaccine, to close the borders, herd immunity, and lockdown. Now, obviously we don't have a vaccine, but at least the government were working on it. So we could close the borders instead. That could be option number 2. We're an island. We've got essentially a gigantic moat around us. We could act like a castle, and we could bring up the drawbridge. Of course, there is a problem. All it takes is essentially one person to come in with the virus, and then we're going to have huge problems. Let's have a listen to Grant Shapps justify why he didn't do anything at the border.
Grant Shapps has literally done the opposite of the world as Transport Secretary. He has done nothing. I would ask him what on earth he's been doing for the last 9 months. No airport testing, screening or measures since the pandemic began. None. No temperature checks, no health assessments, no flight restrictions throughout this entire pandemic. No measures to have air travel actually acknowledge we're in a pandemic. The lack of measures have contributed to the worst death toll in Europe, and he detailed what every other country has been doing. So I put it to you, what have you done?
Yeah, I don't agree with that, Piers, as you won't be surprised to hear.
Went through, in the first phase of this, an extraordinary period where minister after minister appeared on this programme and tried to justify the fact that we didn't make any attempt to close the border or to test people or anything in that first phase whatsoever. In fact, we let 20 million people fly in, it is estimated, many from corona-ravaged countries like Italy, like New York in America, from China and so on, without any testing at all. I think we tested 240-odd people. This was clearly, looking back, you must acknowledge, utter lunacy, wasn't it?
So right at the beginning, I spoke to the chief medical officer and said, shall we shut the borders? To which he said, if you do, it will delay this whole thing by 3 to 5 days, but it's fundamentally already here. It will already spread domestically. An example...
Now, I found that really interesting and quite revealing. Why would it spread domestically unless, of course, you don't have a track and trace system? The simple idea of the track and trace system is someone comes into the country, they have a disease, you need to find out where they are, you're able to do that within a 24-hour period. But that didn't happen because no system was in place. They've put in no preparation for a pandemic. And before anyone comes out and says, oh, well, who could have predicted this? From 2011 to 2021, We had avian flu, we had swine flu, we had the Zika virus, we had SARS, we had another version of COVID that was kicking around in the Middle East. There was plenty of warning signs. Even Barack Obama was on national TV in 2014 saying, "We need to make sure we're prepared for stuff like this." This is why Grant Shapps is told there's nothing you can do once it's here. We have not set up the facilities to be able to cope with a pandemic. Yet, as you noted at the beginning, we were told...
And the public can be assured that the whole of the UK is always well prepared for these types of outbreaks.
And then remember, whose fault is it?
Age of our population, some of that will be recognising the obesity of our population.
And if you want further proof that this was a policy that they were following, have a listen to this.
Acted very quickly when, for example, I'll give you a perfect example.
You left the borders open, which for a government which has built its entire reputation on controlling our borders is absolutely ridiculous. And just to answer the question, sorry, with respect, I'm giving you the answers to the questions you don't know the answers to, which might inform you better to make better decisions. The answer is, as Michael Gove didn't know and you don't know, the answer is we've given 14 fixed penalty notices issued at the border and 20 fixed penalty notices issued by the police. This is in response to 30, 40 million people who've flown into the country.
Hardly tracked anyone. Why? Because there isn't a system up. Why? Because they haven't set themselves up for a pandemic, yet we have been constantly told they were fully prepared. So why leave the drawbridge down? Why allow people to flood in? Well, economically, it's beneficial. We've got people coming in. That increases trade. That increases spending. It also encourages the spread of COVID. And it makes you wonder as to why that drawbridge was left down. Now, we're being told it won't make a difference. 30 million, 20 million people coming in, potentially with COVID, with different variants, isn't going to make a difference? Of course it is. All you have to do is look at places that did close the border. Taiwan, Hong Kong, Vietnam, Australia, New Zealand. They all had systems in place to deal with a pandemic. They'd all prepared for it because they'd witnessed what had happened in Asia. And we had an arrogant look. We had a thought that it'll never arrive here. It's not a problem. Pandemics happen regularly. You need to have everything ready to go and up and ready to launch. In a pandemic, what you're going to need is PPE, personal protective equipment. But again, the government wasn't prepared.
Explain that somewhere like South Korea or Taiwan, which are incredibly densely populated, have had such tiny death tolls by comparison to this country. We're going to try and defend our death toll. Explain that to me.
I'd say two things. First of all, they've been subject of other viruses, which have meant that things like wearing face coverings were sort of second nature to them, and they were well ahead of us.
Why weren't we prepared for that? I mean, I remember Matt Hancock standing up in Parliament on January the 23rd and assuring us that the UK was fully prepared for anything like this.
And we were late on
And in fact, in 2016, we had a whole 3-day pandemic exercise.
Yeah,
So if you're going to cite countries that had better preparation, are you now accepting de facto we were not prepared properly?
We didn't have the manufacturing capability to be able to produce PPE, which is exactly what you need in a pandemic because supplies run out because everyone else around the world is dealing with it. So it has to be within the UK. That should be obvious to anyone running one of these operations. Let's have a listen to the vaccines minister.
Problem with PPE. And in fact, don't take my word for it. Take the word of Boris Johnson, the Prime Minister, at PMQs on the 6th of May 2020. It's been enraging to see the difficulties we've had in supplying PPE to those who need it. But the government's now engaged in a massive plan to ramp up domestic supply. Matt Hancock on the BBC, 11th of April. The challenge is one of distribution. Alok Sharma, there's clearly a need for more gowns, he told Andrew Marr on the 12th of April. Clearly a need for more PPE. We didn't have enough PPE. That's why people were wearing bin liners. That's why so many health workers died on the front line. Why can't you as a government? Once again, it's that old thing of refusing to admit when you got it wrong. We know we were not prepared with enough PPE. Just admit it.
I just said to you, we could only produce about 1% of our need.
So now we're told we're one of the most prepared countries in the world. And now we're told we didn't have any internalized production because we weren't prepared. What is it? This is called gaslighting. The government have massively screwed up and they're blaming the population. If you think I'm exaggerating, just listen to Boris.
But if people don't follow the rules we've set out, then we must reserve the right to go further. We must take action now, because a stitch in time saves 9.
Don't even get me started on the awful communication that they've done throughout this. But do pay attention to the fact, at the very beginning of that, he says, if you don't follow the rules, we're going to punish you even more.
And this way, we can keep people in work, we can keep our shops and our schools open, and we can keep our country moving forward while we work together to suppress the virus.
So not only do they not have the PPE required to go into the hospitals, they don't even have enough to give to the general population, which is why you weren't encouraged to wear masks. In fact, it gets worse because we're starting to see expert opinion, cited in the Japanese Times, that masks might have been one of the key reasons for Japan having such a low transmission rate. Not only was there an issue with a lack of masks within the population, we've obviously got a lack of PPE for our hospitals. We were so short of stock, we were having to reuse. Here's a quote from a doctor in the NHS. You can't say to people for this amount of time these gowns are disposable and then the next day say, oh actually we've changed our mind. That is the difficulty. If they had from the very beginning said we can safely reuse equipment, then it wouldn't be a problem. The problem is that it's constantly changing because it's very much reliant on the stock, not the evidence. But it gets worse, if you can believe it or not. Have a listen to this.
The government does stockpile PPE for pandemics, and that has been incredibly important and useful in our response to this.
So having a huge stockpile sounds really good and promising, so at least they've done that. However, 190 million masks had expired, 116 needles and syringes expired, 28 million respirators expired. Out of the 26 million respirator masks, 80% were expired. Some were 3,000 days out of date, that is nearly a decade. 53% of the surgical masks were expired. All needles and syringes expired. In total, 45% of the personal protective equipment had expired. So this is the warehouse which contains all of the UK's PPE. And the warehouse was receiving regular readouts telling them that this had expired and nothing was being done to update it. What they could do was retest the stock. Unfortunately, they didn't get round to doing that until December, just before COVID hit. So what about track and trace? The world-beating system. Well, there are a few problems with this as well. If you travel to the United States and have the unfortunate event of witnessing a huge storm, hurricane, tornado, earthquake, the Americans have a system in place to inform you about this. The emergency broadcast system. Have a listen.
Emergency alert system.
Now, I'm not going to make you suffer any more to the annoying noise that makes, but the point is that it's there in order to protect you, and it comes onto your TV and automatically notifies you there's a danger coming. We do not have that. Even though in 2017, we had Storm Ophelia. This was a hurricane off the Irish coast. I just happened to go on Google Maps to get across London, and all of a sudden there was a message about a giant hurricane off the coast. Now, the point I'm trying to make here is that people are prepared across the world for different eventualities. People are ready for stuff like this, and I don't believe we are. And it's shown by the fact that we didn't have a track and trace system ready to go. You might even hear people say, well, so did other parts of the world. Well, some parts of the world did, some parts of the world didn't. As I've just shown you, there is an emergency broadcast system in the States. I've never seen one in the UK. We've also had a huge amount of time in which to build an app. This is Snake. It is one of the first apps you would have found on your phone. This is an app. This is how far back we could have begun preparation for a pandemic, and yet nothing has been done. Not until the very last minute, and it has cost us over 30 billion. Germany's has cost 1 billion. That tells me the government panicked and just did whatever it could to get a hold of software engineers who completely exploited them, probably in part down to their ignorance of understanding how much this type of stuff actually costs to produce. but also because we weren't prepared, and as a result, we're having to scramble around last minute and fork out extortionate fees to get people off their current contract to come and work and develop an app that should have been developed 10, 20 years ago. But there's something else, something quite strange. I don't know if you're aware, but the NHS already has a track and trace system and app. Were you aware that there was an HIV contact trace system dating back as far as 2014? This is something that definitely needs to be investigated, and I'm not going to follow it in the scope of what we're looking at now. But my word, something dodgy has really taken place here. If this was handed out to private firms for COVID, yet the NHS had an HIV contact tracing system already in place. Along with the app, you need to be able to contact people. A BBC reporter was able to work with the track and trace system. This is her on a Facebook chat group designed to support people working with contact and trace. Have a listen to what they say.
Haven't had a case in days, and there's 20 comments. Yep, same. Something tells me the system isn't working properly. Surely there's been some positive results in the country. And someone else has replied, must be, the mind boggles.
If you get the chance to watch this video, I'd recommend it. It's a panorama documentary into track and trace. And it's just a shit show. Yet Boris and the head of the vaccine rollout say this.
Hi folks, I wanted to thank each and every one of you for being part of the NHS Test and Trace service as we mark 1 month now since the service was launched, and the progress that has been made and the difference you're already making.
Just for this moment, enjoy and feel deep pride in what you've achieved. It's incredible. Thank you.
Alex Lee then goes on to state that she only ever had one COVID case during a 4-month stint with the track and trace system. The track and trace system turns out to be even worse because the government is not passing on information to local governments and authorities and contacting them to let them know what was taking place.
We are doing much more to be able to trace these individual outbreaks. For instance, there's an outbreak right now in parts of Leicester.
The Secretary of State stood up at a Downing Street press conference and announced that there was, as he described it, an outbreak in Leicester. It was then 11 days before anything happened. You have to say that it was done in a way that was slow and painful.
By September, 20% of COVID positive cases had not been contacted, and by July, only 50% are contacted in 24 hours. That's not enough time to stop that person going around and spreading the virus. And that was only part of the problem.
People in some areas are having to travel more than 100 miles for coronavirus tests.
Another week begins with reports of struggles to get bookings for coronavirus tests. Long waits and frustration for people queuing at a walk-in virus testing centre.
Crucially, the most important bit, in a sense, is that when anybody needs a test, they can get access to it quickly, which is not currently happening at the moment.
Let's have a listen to the Prime Minister's own description of what went wrong.
But unfortunately, we did not have the capacity in public health England, to be absolutely blunt. We didn't have the enzymes, we didn't have the test kits, we just didn't have the volume, nor did we have enough experienced trackers ready to mount the kind of operation that they did in some other Eastern Asian countries, for instance. And I think the brutal reality, Jeremy, is that this country did not learn the lessons of SARS or MERS, and we didn't have a test operation ready to go on the scale that we needed.
And the public can be assured that the whole of the UK is always well prepared for these types of outbreaks, and we'll remain vigilant and keep our response under
control. There have been a host of technical problems, but notwithstanding those problems, the UK is now testing capacity is now up at about 100.
That's very helpful. We'll stop there. That's very helpful.
Now, because the system isn't up and ready to go, or is waiting in the wings to come in case there's a pandemic. This has a knock-on effect, which is a lot of people don't comply. And it's bizarre as well, because you would fly into the airport, and I experienced this myself, very little guidance, especially at the beginning of all of this, of what to do. Then you would go on public transport, which is insane, because you're infecting everyone potentially on the train or bus or whatever else you're taking. Even if you take a taxi, there's still a chance. Even if you take a car, you need to go and get gas potentially. It means they didn't have a plan in place. There's even still a situation with trains where, especially in London, if you need to get off the train, you've got to press a button, and we were all told that this moves and contracts through touch, which is why you're not meant to shake hands. Let's listen to Piers and Susanna grill Grant Shapps on this.
Currently, less than 20% of people self-isolate when they are contacted and told to. That's an astonishing low level of compliance. And you are about to say to people, actually, you don't need to quarantine for 2 weeks. You only need to do it for a handful of days, but they must pay themselves for a private test. I mean, why would anybody isolate at all? How are you going to enforce that?
So the Office of National Statistics, the ONS, did a survey, or did study, in fact, of people in the quarantine category, people who've returned from abroad, and actually did show that the majority were carrying out the 14 days quarantine. They should do, because...
Just said that 20% weren't complying. He's now flipped back and said the majority. Well, what is the majority? A majority could be 51%, in which case 49% aren't. There are no checks. I have witnessed this myself. I came back into the country, no forms to fill in, and I quarantined myself for 2 weeks. No one came to check on me. No one called me. Just a complete mess. And he's giving out false figures.
Quarantine. They should do, because the fines start at £1,000 and they double up. So it can be an expensive business. You can get a criminal record for not doing it.
How many people are you checking are quarantining?
Yeah, it is checked. There are now texts that go out. The
Ooh, a text. Ooh.
Public Health England make a series of phone calls, and it has gradually got tighter and tighter. The fines have increased, and actually we're seeing people complying with it.
Gradually complying with it? Great. The horse is bolted. You've missed your mark by so much. It's a joke. And again, why? Probably because they're not prepared.
What's the percentage of people complying with that?
Yeah, so even...
Notice the stuttering there. Stress. Don't want to give an answer.
So the ONS suggested it was a majority who complied. Nonetheless, I do recognise 14 days is a long time for people to quarantine or self-isolate for. And one of the things that we know is actually if you provide a practical alternative to people, people generally want to do the right thing. You've got to give them the option to be able to do the right thing.
I find that really interesting. You've got to give them the option. Well, if you're only paying them £90 a week for sick pay, that's not giving them an option. That's forcing them to go back out. And it begs the question, why would you do that? It makes me think, is this herd immunity again? Is this forcing people out? Is this desperately trying to keep the economy going instead of saving lives? On a more direct note, I'm really sorry about these really horrible pictures of Grant Shapps.
We also know that the individual has to pay for the private test. Private test, as I understand it, is more than £100. Now, how are you going to enforce that added cost onto people? And if they cannot afford to take that private test after they've shelled out for their trip, are you still expecting people to serve the full 14 days in quarantine?
I generally get the impression that Tories just don't get money, like what it's like to actually have no or little money to survive on. They've got it in their head that we can afford a holiday, so a couple of extra £100 is fine. Or you stay at home and you get 180 quid for half of your month in compensation for doing the right thing for protecting the nation. Let's have a listen to Grant Shapps doing a bit of gaslighting here and bald-faced lying about justifying the cost of 22 billion being spent on this track and trace system. Bear in mind, Germany says cost 1 billion.
Grant Shapps, why have we spent 22 billion on a test and trace system where there is no clear evidence that it has contributed to a reduction in coronavirus infection levels?
I saw that report this morning. I thought it was pretty extraordinary, and your viewers can judge for themselves. 9.1
Well, it's from the
million
House of
people.
Commons Public Accounts Committee.
Yeah, well, it doesn't mean that immediately you accept just the headlines of it. Listen to this: 9.1 million people who otherwise would have been walking around spreading coronavirus because they're individuals who'd had it, were contacted by Test and Trace and required to self-isolate. They're contacting over 93% of people, whether or not the contact details of the primary contact has been passed on. That's pretty successful in my book.
We had a problem the other day where you had one individual that it took weeks for you to track down. One individual. I mean, you know, this is a multi-billion...
Just watch him pull back a little bit here. It's a body language sign that he doesn't want to be involved with this. He wants to push away.
£1 test and trace system. The report said there is still no clear evidence to judge its overall effectiveness. There's no clear evidence yet. It is unclear whether its specific contribution to reducing infection levels, as opposed to the other measures introduced to tackle the pandemic, has justified its costs. And I just point out, nurses will be looking at that and looking at the fact that consultants have been paid thousands of pounds a day and wondering why they, the nurses who have sat by patients' beds throughout this pandemic, they only get a 1% pay rise, which in many cases amounts to a pay cut.
So just to add insult to injury, the 22 billion that is now being spent on this system, which doesn't seem to work and has been spent because everything had to be done last minute, has now meant that nurses got a 450 million pay rise instead of maybe a couple of billion.
So taking the first part and then the second part of your question. First of all, look, one individual was located, even though they've made a mistake and hadn't filled in their details. That to me is the success of the system rather than the failure of the system.
Some lying and gaslighting there. In fact, what actually took place was that the person in question called up the track and trace centre and told them of who they were and that they believed that they were the person in question. 22 billion, and it still doesn't work.
And you know, these variants that we're also worried about, the South African variant, the Brazilian variant, because we've got this test and trace system in place, there've only been 285 cases of the South African variant and only 6 of the Brazilian one, because we're finding the people and helping them to isolate.
It only takes one to get through the net to then cause further problems. This is why I've always been a proponent that everyone should isolate as they come into the country. But again, because we hadn't been prepared, we didn't have a system in place to actually have all those people housed and looked after whilst they go through a 2-week quarantine. But Sharps here seems to be able to make it sound as if this is a good thing.
Nick McPherson, who was the permanent Secretary to Treasury, has said the win for the prize of the most wasteful and inept public spending programme of all time. The extraordinary thing is that nobody in government seems surprised or shocked, and you meting out that. You don't seem surprised or shocked that billions, 22 billion and rising, has been spent on something that he says is the most wasteful programme spending in history.
This comes on to my final point, herd immunity. So what is herd immunity?
Herd immunity. That's the idea that once enough of a population has been exposed to the virus, the population as a whole will build up natural immunity to it. That mattered because it suggested allowing the virus to spread may have been a deliberate policy.
And that's interesting because as of today, Dominic Cummings is saying herd immunity was government policy. So what I'm now going to do is pass you over to Piers and Susanna, who are going to talk about this with Michael Gove.
Sweden pursued a policy of herd immunity, which most scientists thought was nuts.
No,
It now turns out it was nuts. It's also true, because we know this from Patrick Vallance, that we were pursuing a policy of herd immunity right to the point the modellers came back and said it would cost 500,000 lives, at which point there was a screeching U-turn. That was another one of the terrible mistakes that we made in the early stages of this pandemic.
I think it is also the case that it's important that you should clarify that the UK government was never also pursuing a policy
Well, Patrick
of herd
Vallance
immunity.
said, actually on Radio 4, on record, on tape, that that's exactly what we were doing. And so when you guys say we weren't doing it, why did no one tell the chief scientific advisor? Because he was under the impression that's exactly what we were doing.
Advisors advise, ministers decide. That was
You
never
were
the
following
policy
the
that we were
science
following.
at the time. Do you remember? You told us every single day we are following the science, not guided by, not listening and making our own decisions. We're doing what the scientists tell us. Your chief scientific advisor on, I think it was March the 16th, on Radio 4, around that week, he said quite unequivocally that we were following herd immunity.
Also, because most people, the vast majority of people, get a mild illness, to build up some degree of herd immunity as well, so that more people are immune to this disease and we reduce the transmission. At the same time, we protect those who are most vulnerable from it.
Would suppress this virus. All of the evidence from previous epidemics suggests that when you do that and then you release it, it all comes back again. So the other part of this is to make sure that we don't end up with a sudden peak again in the winter, which is even larger, which causes even more problems. So we want to suppress it, not get rid of it completely, which you can't do anyway.
Unless, of course, you're Hong Kong, China, Vietnam, Taiwan, South Korea, Australia, New Zealand. You can do it then, but not in Britain.
Not suppress it so we get the second peak. And also allow enough of us who are going to get mild illness to become immune to this, to help with the sort of whole population response, which would protect everybody.
Yeah, I mean, that herd immunity I know you talked about yesterday.
He has literally described herd immunity, the process and the plan that the government's going to take.
When you were appearing with the Prime Minister, in terms of building up a herd immunity within the UK, what sort of percentage of people need to have contracted the virus?
Probably about 60% or so. And we think that this virus is likely to be one that comes back year on year, become like a seasonal virus, and communities will become immune to it. And that's going to be an important part of controlling this longer term.
60%?
60% is the sort of figure you need to get herd immunity.
I mean, even with that, even looking at the sort of the best case scenario, I know we were talking last week and you were saying, you know, half of 1% to 1% fatality in something like this, that's an awful lot of people dying in this country.
Well, I mean, of course, we do face the prospect of, as the Prime Minister said yesterday, of an increasing number of people dying. That is a real prospect. This is a nasty disease. For most people, it's a mild disease. It's important.
And if you're still not convinced that it's government policy, and it is hard to take, have a listen to the Prime Minister talk about spreading the disease throughout the population on This Morning.
Essentially trying to spread this out so that it doesn't all happen at once and overwhelm the NHS, and that you can actually delay it into perhaps the summer when it's a little quieter and the ordinary flu might have died down a wee bit. Is that what you're doing?
Well, it's a very, very important question, and that's where a lot of the debate has been. And one of the theories is that, you know, perhaps you could sort of take it on the chin, take it all in one go, and allow the disease, as it were, to move through the population.
So what he's essentially saying is to have herd immunity, to spread it, and then to shut it off so you don't overwhelm the NHS. That's the plan. It's herd immunity and lockdown combined together. That is what they want to do. It is illegal to kill your own population. Just listen to what Valence says and compare it to what Boris has just said.
Allow enough of us who are going to get mild illness to become immune to this, to help with the sort of whole population response, which would protect everybody.
Yeah, I mean, that herd immunity I know you talked about yesterday.
Without really taking as many draconian measures, I think we need to strike a balance. I think it's very important. We've got a fantastic NHS. We'll give them all the support that they need. We'll make sure that they have all the preparations, all the kit that they need for us to get through it. But I think it would be better if we take all the measures that we can now just to, you know, to stop the peak of the disease being as difficult for the NHS as it might be. I think there are things that we may be able to do.
Little to no PPE, no production for PPE, no ability to track or trace. So what does that leave you as options? lockdown or herd immunity. They went for an experiment. They experimented on the British people, the idea of herd immunity. Get them infected, it's not a problem. It's a massive problem because you're dealing with a disease that you don't know enough about. They keep telling us they're following the science, but they didn't know there was a thing called long COVID, which now about 1 million people in the UK are suffering from. That is damage to lungs, that is extreme fatigue, that's inability to work. That means the population that is healthy and has survived are now probably going to have to support that 1 million. Now have a listen to Michael Gove once again deny that this was a policy.
And the attempt by the British government to deny what your own chief scientific advisor said on the record then, I'm afraid will not survive a public inquiry because he said it on the record on radio.
We were not following a policy of herd immunity.
Why did he say we were?
You will have to ask Sir Patrick, a great man who offers
So he didn't know what
advice.
policy the government was following, and he's your chief scientific advisor.
Yes, but I'm the minister, and I'm telling you that we were not following a policy
So you were following
of herd
the
immunity.
science, but ignoring the science.
You can see that Gove is starting to become quite pressured here. He's becoming uncomfortable. He moves around in his seat quite a bit. All signs that he's not enjoying this. But would many of us enjoy being interrogated by Piers Morgan?
Our policy is...
Heavy amounts of stuttering going on there. Stress. He's gritting his teeth.
Informed by the science, and one of the reasons...
Yeah, but you said at the time you were following the science. You can't be informed and following it and then ignoring it. It's either one or the other. You're either following it or you're not. I can go back and play 100 clips of ministers saying you were following the science. You said it every single day. Now you're saying the chief scientific advisor had no...
Heavily moving around in his seat. There's a bit of a smirk there.
...idea what he was talking about, and was talking about a policy that none of you were following.
No, I'm not saying that he had no idea what he was talking about. He knows a great deal more about these issues than a number of commentators. But the whole point is that when you receive scientific advice, you weigh it against a number of different considerations.
So he advised you to pursue herd immunity and you said no. Is that the new position?
No.
Really bizarre piece of interview footage. You can't tell what's going on. We've obviously got Valence and Boris saying and advocating, pushing the idea onto the public of herd immunity. And then you've got Michael Gove outright denying it and saying that none of these things took place. And yet we've all seen the footage. I mean, couldn't get any more casebook gaslighting if you tried. Obviously someone is lying here.
It is the case that scientific advisors and other advisors lay out a range of facts and a range of options, and they allow ministers to look at that. Obviously, there is a boundary. There are some things that any government could do which would be in defiance of the science, but the whole point about scientific advice is that it lays out that there's necessarily
well, that's what we kept saying. But you lot kept telling us you were following the science. Now you're guided by it, but then end up doing different things. I'm just saying the record will speak for itself. You can go back and listen to all the interviews. I know what Patrick Valence said. I know what he said because I heard it on the radio. Anyway,
yes, but I know how these decisions were taken. I don't think you were in the room.
No, but I'll tell you where I will be in the room. I wasn't allowed to be in the room, but I will be in the room for the public inquiry, Mr. Gove.
There you have it. The record from the UK government on TV, clearly explaining what their policy was, herd immunity to begin with lockdown, and when they got the figures, they panicked and they changed their mind on what to do and went for some form of just lockdown. But a lot of the things that they did were as a result of them not having any coherent plan to begin with. Bear in mind that they had Operation Cygnus in 2017 for a pandemic procedure. Between 2011 and 21, the world and the UK had been hit by several viruses. Zika, avian flu, even Barack Obama came out in 2014 and stated that these things need to be put into place to deal with these viruses that seem to be popping up more and more frequently within the world. The Conservative Party had been in power for 10 years and they'd literally done nothing. No track and trace system, no emergency broadcast system, no PPE production system, no PPE in quantities that were needed. And this has led to the deaths of 130,000 UK citizens. And because of this lack of preparation, they went for herd immunity. So if you, or a loved one, or a friend has been affected by COVID, has died or has long COVID, consider taking the government to court for breach of the ECHR. I hope you enjoyed my political observations this week. If you'd like to support me, please share the video with others and post about it on social media. If you're keen for more, subscribe, comment, like, and hit that notification button. Thanks for listening, and see you next time on Political X.
Right. No, Nick's right. I mean left. Yes, this left. Oh bugger. It was that left. What? Turn around. Or indeed, don't turn around. Just carry on. Yes, onwards. You have arrived at your destination.